Hi, my name is Amy and this is my ostomy bag change video. So to start off with, I'm going to need a washcloth with warm water and soap or gauze, some gloves, chucks, scissors, and an ostomy roller. And I'm going to first start off by verifying the procedure and making sure I have the correct doctor's orders before I go do it. And I'll head to the room, close the door or the curtain to give my patient some privacy, and perform my hand hygiene with some hand sanitizer or water. And I'm going to put on gloves just to assess the ostomy. Okay, and I'll just verify the patient's name, date of birth, and let them know what we're doing. So we're going to be changing the ostomy bag. So we're going to go ahead and lower you on down so that you're in a supine position. And I'm going to turn this here so you can see it. So this is my ostomy bag that my patient currently has on. And to start off with, I am going to put a checks down just right under the bag so it doesn't accidentally spill everywhere, and then we have to change the bedding. And I will start off with just assessing and then simply pulling off the bag. If this is full of liquid stool, we would want to measure that. If it's solid stool, we can just dispose of it. So we'll dispose of that in the correct biohazard container. And here we have our stoma. And we'll go ahead and peel this off. We're going to kind of pretend that we're peeling this off just because it's pretty stuck on there. And we want to make sure that we're not damaging the skin when we do this. I'm actually going to flip this on over. And once we get over to the other side, we'll put the stoma back in here. So we took off the ring and we're just going to check the skin, make sure there's no breakdown. That looks okay. We can also use a non-adhesive remover to help get off the ring if necessary. And then we'll take our warm water and our basin of water and clean the stoma. And we just want to be gentle while we do this because we want to make sure we don't irritate the stoma. And then pat it dry. We want to make sure it's pretty dry before we stick a new bag on. Also helps with getting the ring to stick. And while we're here, we're going to look at the stoma. We want to make sure that it's a red-pink color. If it's blue or purple, we want to be concerned about that because it might not be getting the proper oxygen flow. Okay, and then from here, we'll go ahead and measure our stoma. I'm just kind of looking at it. And it looks about 2 inches, which is this one right here. Some rollers have a hole in it, so you can actually try it out. This one does not, but it looks about 2 inches. So from here, we'll go ahead and take our new ring and we will cut out the 2 inches, which I was practicing, so I already cut mine out. But yeah, we just go through, make sure we cut it out. And it does have usually a measure that tells you how wide you're making it. And then from here, we're going to go ahead and change our gloves because we want to do this with cleaner gloves on. And perform our hand hygiene again. Check on the patient, see how they're doing, make sure they don't need anything. And then we'll go ahead and put on some new gloves. Okay. Perfect. And then get our ring ready to apply with our cleaner gloves on after we cut them. So we'll just go ahead and stick that on. And we want to make sure we're not hitting the stoma or causing any abrasions on it. Super sticky. So you would want to make sure you do this little we have that nice and attached because we don't want the bag emptying out on the patient or hitting the skin and causing a skin breakdown. And then we'll grab our bag, and this bag has a clip on it. Well, some of them have a clip. This one just has a tie, so we'll tie that because we don't want the stool to fall out. And then we'll just clip on the bag. Just kind of right over the stoma. Like so. Perfect. And make sure it's on okay. Perfect. And we can go ahead and remove our gloves and clean our patient up and perform our hand hygiene and set them back up if that's more comfortable for them. If they would like, sometimes they want to see their stoma, so you can give them a mirror so they can see it as well. And from here, we would go ahead and just document the procedure, document the size of the stoma, and go from there. Thank you.